Hi there, and let's talk about epistaxis. I'm Nelton Tobias. Epistaxis is bleeding from the inside of the nose, or you can simply call it nose bleeding. This is a sign and not a disease, therefore, assessment should be made to find the cause. The nose is supplied by branches from internal and external carotid arteries. The branches from internal carotid arteries include anterior and posterior ethmoidal arteries, and the branches from external carotid artery include sphenopalatine, superior labial, and greater palatine arteries. This is a picture or a diagram which shows blood supply of the nose. You can see the blue area. That area is called the Little's area. You can see the cycle. So at this area, there are blood vessels, a network of blood vessels. And this network is called the Kisselbach's plexus, and that is where most of the nose bleeding occurs, or you can say anterior epistaxis. So the blood vessels which contribute to this Kisselbach plexus, there are like three. So there is the anterior and posterior ethmoidal arteries, but also there is a superior labial artery. Don't forget about that. That is a most common question in which they ask in the ENT department. So epistaxis is categorized into two parts. There is an anterior epistaxis and a posterior epistaxis. So as we have said, anterior epistaxis, this comes from Arito's area, from Kisselbach's plexus. Posterior epistaxis occurs posteriorly inside the nose, and that area is called Woodruff's area. Epistaxis can arise from different parts apart from Little's area. It can come from above and below the middle turbinate, a posterior part of the nasal cavity. It can be diffuse, or it can come from nasopharyngeal area. So there are different causes of epistaxis, a lot of causes, but we have categorized them into three categories. There are local causes, there are systemic, and there is the idiopathic causes. So starting with the local causes, it can be local causes. First of all, it means the source of the bleeding, the cause of the bleeding is from within the nose locally. So it's starting from there. But systemic cause, it means that the cause is elsewhere apart from the nose. It can be it's coming from maybe diseases from a different part of the body and not from the nose itself. So let's see some local causes. There's a blow to the nose, can be a punch from a fist, can be a finger pricking, violent sneeze, hard nose blowing, infection such as acute or chronic rhinitis, neoplasm such as benign hemangiomas. These tumors bleed a lot. It can be a foreign body or atmospheric pressure changes. Systemic cause includes hypertension. It can be a mitral stenosis, hemophilia, thrombocytopenia, von Willebrand disease, vitamin K and C deficiency. Also, it can be infections such as malaria and TB. And lastly, it can be liver diseases. Example, liver cirrhosis, which can lead to decrease in clotting factors such as factor 7, factor 9, and 10. But lastly, it can be idiopathic, and most of the times, the cause of epistaxis is not known or clear. Let's see about the management of epistaxis or nose bleeding. I have categorized them into three parts. The first one is first aid, the second one is history taking and physical examination, and the third one is other measures. So in first aid, first of all, the patient should pinch the nose for about 5 minutes on sitting position and leaning forward. The second one is history taking and physical examination. You have to take the history, you have to know about the patient to rule out other causes of epistaxis, systemic causes, local causes. so as to find to remain with one cause which you can start to treat that cause. So the third part and last one is other measures, which include anterior nasal packing, posterior nasal packing, chemical cauterization, which they use silver nitrate with normal saline. This chemical helps in coagulation and facilitate clotting. That one is electrical cauterization, in which they use electricity by an instrument called a diathem and causes coagulation by electricity. And the last one is ligation. This is done surgically, ligation, whereby they bind or they clamp those arterial sources which they are bleeding from. This is a picture or diagram which shows the first aid for a nose bleeding patient. So a tick, that a green tick, that is the correct position of doing the first aid. The patient should be on sitting position, leaning forward and pinching the nose for about 5 minutes, and not otherwise. Like the pictures which is marked X, the patient is leaning backwards. That is not the correct way. And these are my references. You can use clinical methods in ENT, or you can use diseases of ear, nose, and throat, 16th edition. These textbooks are very good for learning ENT, or you can learn Epistaxis through these books. And thank you for watching. Don't forget to comment, like, and subscribe to the channel for more videos. Thank you.